Good afternoon and welcome to another episode of Home Care Hot Seat. Today I'm joined by the co-founders of Radfield Home Care, Dr. Hannah MacKechnie and Alex Green. So if I could just start by asking you about, this time last year I spoke to you in your offices. You just moved into your head office.
Yeah, that's right. Yeah.
Yeah. So how has the company grown since then, since we last spoke?
Well, absolutely. We've moved office, which has been great. So we're now based right in the heart of Shrewsbury, which is a lovely little town. So really handy for our franchise partners and also anyone interested in joining the franchise network to come and see us. So it's been a really positive move. And I think in terms of how growth has been since then, it's been a strange time. I think it's fair to say. So what we experienced really is that obviously throughout the sort of onset of the pandemic, the interest in franchise sales just decreased quite significantly. But over the last few months, we've seen that that's picking up again, which is really encouraging. And I think also obviously the pandemic and lots of news around home care, and I think it's shone a different light on the sector. It's always been a bit of a poor cousin to residential care, and I think actually it's been really positive to see home care being talked about in the news. And I think just raising the awareness amongst the general population that our services do exist, and our carers work incredibly hard, and they're out there every day looking after vulnerable clients in their own homes. So I think from that perspective, it's been there is a positive to come out of very, very difficult, challenging times.
Yeah. So you have seen an increase in demand as a result of the media highlighting home care.
Yeah, yes, I think that will hopefully increase as well. I think as people look at the sector and they can see that it's resilient. It's something we've talked a lot about over the last few years, because we actually set up Radfield Home Care in 2008 when we were in the sort of financial crisis and the recession due to that. So something that we've been aware of, and then having sort of existed and run the business through the pandemic. Obviously still a long way to go yet, but it's just really highlighted again how resilient the sector is. So I think that's obviously very appealing for people who are looking to invest or make a big lifestyle change and set up a franchise business of their own. So I think we'll see that trend continue.
Okay. You spoke briefly just then about the challenges of growing the company because of the decreased demand for people joining your business as a franchise partner. How have you kind of overcome that challenge?
I think it's really sort of carrying on doing what we do. It's talking about what we do so if people are touching base with our sector for the first time, it's sort of informing. There's quite a lot of information and making sure that people are aware of exactly what services we do, that we can provide. I think as well it's very much a lot of the general population still see home care very much as home help type services. So it's housework, it's meal preparation. They don't really understand that actually it's a broad range of services. So I think a lot of that is information and education really around what we do, what services we can provide.
Okay. And you had a national office team of 10 this time last year, and you were in the process of recruiting more people. So can you tell me who you've brought on board and how they're helping to grow the business?
Yeah, absolutely. So since we last spoke, we've brought on more people into our marketing team. So we've now brought on a content manager, and we've also brought on digital marketing executive to support our franchise partners with their marketing needs and requirements in their local area. And also we've just more recently appointed our operations director, Neil. So that's a really exciting appointment for us. He comes with a very strong financial background and supporting businesses to grow. So he's going to be a real asset to our franchise partners across the network.
Okay, great. And Alex, could you just touch on it as well, the challenges of growing a company during the pandemic and attracting a workforce?
Yeah, sure. I suppose it's a tale of two halves, isn't it? It's in the care side of the business, through the pandemic, there's been a very consistent need for our services. We've seen some strong growth of all of our offices through the pandemic, the lockdown. So I think on that side, the challenges haven't been about growing the business. The challenges are about keeping the business safe, keeping it secure, keeping the carers safe. And that's been very much our focus so far this year. On the other side, with the franchising, I think we were not surprised, but I think it was good to see that there was a strong level of interest all the way through the lockdown. So the inquiries that we were having didn't stop. There were people who wanted to speak to us about care, and I think that was kind of, you can sort of see the pandemic's going to end and things are going to go back to normal. So people were using that time maybe where they were at home thinking about the future to make some inquiries and think about what was coming on down the line. So it was good to see that interest was still there. I think the challenge now really is the fact that it's still quite difficult to launch a business in the current climate. And I think the main challenge really is kind of the financial side of things. So the banks are very positive about franchising as a sector, and specifically home care as a sector within franchising. It's been earmarked as one of their number one priorities to kind of see as a resilience through the pandemic. So I think that gives us a lot of confidence. But there are some structural things that aren't in place with the finance at the moment. So it's very difficult for new businesses to borrow money. It's not impossible, but it's not as easy as it was. And we're waiting now really until Brexit's finalised and probably into next year to see some of the government guaranteeing schemes coming back online, so that it makes it easier for new businesses to access the initial finance they need. And that will make a significant difference, because obviously most businesses launch with a financial need. So that's going to put things back on on track. I think there's a lot of interest, there's a lot of people building up, waiting to get ready to go. But there are still some challenges in actually getting pushing the go button with setting the business up. Having said that, people are doing it. They are out there. We have franchise partners at the moment who are in the process of launching their businesses, so they're out there finding offices and recruiting their staff. So it is happening. And I think as Hannah mentioned, it's the pandemic has highlighted the need for care. It's put a spotlight on carers as a career, as something that's a very worthwhile thing to do, and for people wanting to come in and build a business, it's given a real focus that actually you can build a business that makes an enormous difference to your community. So that's really positive. I think we've been working really hard in the shadows for a long time as a sector, and it was very nice to kind of be have some more recognition and have people see that it's such a valuable thing that we do.
Okay. And you've moved your franchise discovery sessions online. That was back in April, was it? Is that right? Yeah. How have they been received?
Well, I mean, we obviously we did that as a response to the lockdown. It was very difficult to have, impossible to have face-to-face meetings, but it was something we'd been thinking about doing anyway. Really, sort of, to make it easier for people to access that initial conversation, to find out more about the sector without having to come and sort of meet us face-to-face. It seemed to be the way things were moving anyway. So I suppose the pandemic gave us the push to get it launched. So we started doing that, and it's been very positive, very successful. I think the feedback's been very good. People, they can meet with us, find out everything they need to know about us, and then if they are interested, they come and talk to us face to face, where we can do that. So it's worked very well.
Okay, thank you. And many care providers, Hannah, have reported a surge in job applications for frontline roles since then. Have you experienced the same? And if so, how have you managed to whittle those candidates down to to make sure that they're suited for those roles?
Yeah, absolutely, Sarah. I mean, initially we were flooded, I would say, with applicants for care assistant roles, which is actually quite unusual in our sector, because recruitment's always been quite a challenge, a sector-wide challenge. So that was a real sort of turning of the tables for a period of time. It was quite difficult, actually, I have to say, to whittle down those candidates, just because of the sheer volume, and because our offices weren't geared up to having that volume to deal with. However, what we found is that throughout, as the pandemic and the months have moved forward, that demand definitely settled, really, once the furlough scheme was opened and established, we found that the sort of immediate, I think, panic, knee-jerk, I need a job sort of reaction, which drove a lot of that initial flurry of applications, started to settle down. So now I would say it's not quite back to pre-COVID levels. I think we are seeing still quite a boost with recruitment. People are interested in it. And I think, as we touched on before, the sort of spotlight that's been shone on the sector has meant that more people are aware of the roles that are available. But certainly it's definitely settled considerably, I would say, from our experience, from the initial start of the pandemic.
Yeah. Have you been able to retain the people that have come to you from other industries as they've been furloughed?
I would say the answer to that is a bit of yes and a bit of no. It's we've had some people join us once the furlough scheme was, when people on furlough were then allowed to work in health and social care at the same time as being on furlough. So we had a number of people join us across the network at that point. However, for a lot of those, we always knew it was going to be just a temporary situation, really. So of those people, probably a large percentage of them did actually, once they were able to, they returned to their original job. But we did actually see some people really enjoy working in our sector and have actually decided to stay working in the sector, which is fantastic. It's been really nice to see that.
Okay, fantastic. Okay, you recently revamped your employee retention and wellbeing strategy, Caring for Carers, as well. Could you tell our listeners a bit more about that, how it works and how it's helped support the workforce?
Yeah, of course. We launched our Caring for Carers pledge many years ago now. It was when we first set up this business, we were always focused on wanting to be a really good employer. So we wanted a way to demonstrate to our workforce how we were going to look after them properly. So that was where the Caring for Carers pledge really sort of came about. So we decided, after, it had been many years, so we decided that we'd revamp it a bit. So really we've changed it, not significantly, but really the whole focus is around trying to drive the right organisational culture across our network of franchise partners and franchise offices that will then enable us to empower and appreciate and reward all of our care and office staff who work incredibly hard. So that's really sort of what it is in a nutshell. It then, I think, in terms of how we bring that to life and what impact it has, it's very much around all of those areas: the empowerment, the rewarding. We're living wage accredited across many of our franchise offices. It obviously depends a little bit on area to area, but where possible, that's something that's really important to us as well. And also encouraging our staff to develop their skills and to progress with us in the organisation. So overall, I think the effect of it is it does drive retention. So we have high levels of staff retention and also client satisfaction, because what we found is when we talk to our clients, they really value the relationship that they have with their carers. So it's really important to our clients to know that the carers are well looked after, that they're paid properly, and so that's something that we found, certainly.
Okay, and what impact would you say that the coronavirus pandemic has had on your workforce in general?
I think initially it was there was a lot of fear of the unknown. I mean, no one knew quite what we were heading into when the pandemic started and we went into lockdown. So I think one of the biggest concerns at the beginning was that the government guidance was changing so rapidly on a daily basis. We were having so many updates, and it left our offices feeling probably not, worried that they weren't on top of things. But then I suppose the reassurance we could give is that we had a team in place that were keeping an eye on all the changes to legislation and updating very quickly. So through that, we managed to get all of the correct PPE in place very quickly, the correct guidelines and working practices in place quickly for the staff. So I think that sort of initial fear subsided pretty quickly. I think that's been an ongoing challenge, but most of our carers have shown huge bravery, huge commitment to their clients through the pandemic. We've seen some outstanding things happen. in terms of the commitment to looking after their clients on a daily basis. So I think that's something that the carers have all risen to the challenge, very definitely. It hasn't been without its challenges. It's you know, it's a worrying time for everybody, especially with carers at the front line. But certainly, I think with the support of our office teams, with the support of us, making sure that everything's in place for everybody, and working together, we've kind of been able to give a level of support to the carers that has worked very well. And I think knowing that we were probably going to be heading into a second wave this winter, we did a survey with our carers across the network, so in each office, to find out how they felt about our response. You know, how supported did they feel by their managers and by the organisation. And you know, the response was overwhelmingly positive. I think that the carers generally felt very, very well supported by their teams. But nonetheless, we did that to find out if there was anything we can improve sort of moving through the winter, because you know, it may be that we have challenging times ahead. So you know, we constantly trying to improve what we do. But I think that's been, you know, the main impression we've been left with is that we've done our best in challenging times. Our carers have done outstanding work, and we're very proud of them all.
Yeah, indeed, and you should be. And obviously, as we're entering a second wave now, as you just talked about, how can care providers like yourself re-energise those frontline staff to keep going, to keep that momentum going?
Yeah, I mean that's a key thing, isn't it? I think it's about keeping people really focused and keeping the teams energised on looking after the clients. That's what we're all here for. Ultimately, is to make sure our clients are safe, they're well looked after, and they have well-being in their lives. That's the key. You know, and one of the big challenges with lockdown, I think, was loneliness and people feeling isolated. And I think that wasn't just our clients; that was across the whole population. You know, people were really struggling with that. And that's something that we can offer to our clients. You know, our carers go in regularly. And it's something that we saw that there was a strong need. You know, people felt they wanted to keep contact with our carers. They wanted to keep the care services going. And I think moving into a potential second wave, or, you know, through the winter, it's about making sure that, you know, we praise our carers, we reflect on what they're doing. We take any feedback from the clients and we share that with them. We make sure everyone's fitting well, that they have breaks, that they have, you know, good rest as much as anything, and that the office teams are well energised to support the carers. And I think that's really what we have to do, is keep focusing on the mission that we have and keep everyone really, you know, working towards that shared goal.
Yeah. Okay. And Hannah, Alex spoke briefly then about loneliness affecting your clients. How have you been able to keep the spirits alive, and, you know, make them feel less isolated, more connected?
Yeah, I think in a variety of ways. I think during the lockdown period, obviously lots of families weren't actually able to visit their elderly relatives, so we were in many cases the only people that were allowed to go into the homes. So put a real duty of care onto us and our care teams to make sure that we were looking after, you know, that individual holistically. So, you know, just making sure then that we stepped up the communications with families so that they can hear from us regularly and hear how their loved one is doing. Also, carers supporting clients to contact family directly. So, you know, in many cases helping them use Zoom for the first time or something, you know, similar to that. So lots of really positive stories across the network on how our carers were really able to impact positively and help try and keep those you know, relationships and the communication going between loved ones. So that was a really key point. And I think also what we found at the outset of the pandemic is because we didn't really know what we were going into, we actually contacted a lot of our clients who just had very low level needs, so just really a bit of companionship care, etc., to see whether they needed those calls, because we were very mindful we didn't want to introduce risk into their home if they didn't really need it. So we had lots of conversations with our clients on that basis at the outset, and overwhelmingly the majority of them wanted to keep the care in place because they value it, you know, just that carer coming into their home and the relationship that they've built up. So actually we found that lots of clients just carried on with their care regardless, because it's important to them, to actually see those individuals and, through a very, very difficult time.
Mm. And did you face many cancelled care visits at all?
Not really, no, because of as I've just said, people actually, even though we contacted them and to see if they wanted to cancel, and also it was from a business perspective as well, we weren't really sure how much. It's really looking at sort of our resilience and continuity plans, just making sure that we had enough staff available to care for our most dependent clients, because at any point we didn't know how many of our workforce would be having to self-isolate or indeed be unwell with the virus. So we were looking ahead at careful sort of contingency planning, but actually we found most of those clients didn't want to cancel their care. A few did, but then as their sort of confidence rose, I think as the PPE pipelines and supply chains and everything was more established, lots of those clients came back to us, sort of after a few months, really. So not a significant change at all.
That's really good news, because I think that's one of the fears, isn't it, amongst some people in the industry, that people aren't reaching out for that care.
Yeah, absolutely. And we have seen lots of clients start care through the pandemic as well, which has been an interesting process, really, because it's it's a big step to take anyway, but I think where families weren't able to pop in and do their usual sort of well-being checks, do a bit of food shopping and things like that for an elderly relative, especially if they lived a bit further away, they really felt cut off. So putting a care provider in place to make sure that all of those basic needs were being looked after, and also that they were being kept in the loop, was really important. So we actually found that we were generating quite a lot of inquiries for people with quite low level needs throughout the pandemic, which surprised us, but we were able to do that safely. So that was great.
Have you found that many people have come out of care homes and switched to home care?
To be honest, we haven't really. It's not been a theme that we've seen. I think it's lots of people in nursing homes, particularly. I think their needs are such that it makes that quite a challenging process. From residential care, it's more possible, but no. I mean, we do have a number of clients that we actually support in residential care settings and nursing home settings. So carers will go into that setting, and then it's really more around companionship or specific care tasks for those clients. And we've carried on providing that care, but we haven't actually seen people sort of requesting to come out of residential settings.
Okay. And you created your digital support system back in December. How has that helped you stay resilient through the pandemic?
Yeah, we did. We launched our sort of communication portal, if you like. So it's been really useful. It's actually been fantastic through all the many changes to legislation and regulation, just keeping on top of that, being able to communicate that out to our network in a really efficient, clear way. So from that perspective, we've really put it to the test as soon as we built that into the business. So that's been great. And I'd say another real benefit of it is that it allows us the network to communicate with each other more effectively. So we've got the ability through our the digital communications platform, Radius, to actually allow our care managers to all talk to each other, our care coordinators to all talk to each other and share best practice and information and news and ask for advice. So from that perspective, it's been a really powerful tool for us. Yeah.
I think it's a growing area, massively growing area now.
Yeah, definitely. Yeah, absolutely.
So Alex, you've spoken openly about the benefits of investing in technology. Could you explain the benefits to our viewers?
Yeah, of course. I mean, we've always been interested in how technology fits within care services and how it can enhance what we do. And I think where we've reached a point now where some of the in-home technology systems have matured to the point where they're useful and accessible. And I think they're the two things. It's, there's been some very clever systems that weren't really accessible for people, and that's a key point where things become affordable, accessible, and the technology does the job it needs to do. And I think we're sort of reaching that point now. And so for us, it's a key thing that we look for to enhance what we do. And I think that there is a strong role for technology to play in home care services, particularly around sort of keeping people safe when carers aren't there. And that's a key thing. You know, obviously our carers go in and visit intermittently through the day, but there's long periods of time where people don't have carers present, or maybe but before someone even needs carers to actually attend to them at home, there is still maybe a need for something that keeps an eye on people and keeps them safe. So passive monitoring is a key area, I think, where this is, you know, it's really useful now. You can put in a non-intrusive system into somebody's home that just basically alerts if there's a problem. So if there's been a fall, or if there's potentially an illness that's progressing, the change in behaviour gets noted by the system, and that can be flagged up to a care provider like us, who can then intervene and help. And that's something that's, you know, an amazing benefit for people. So, you know, without actually having to have carers in your home, you can have some technology that keeps an eye on you. And for a lot of people, that's what they need. There's a sort of gap between needing carers to attend and where, you know, maybe things start to change in your levels of independence, where technology can fill that gap very clearly. So we're very keen to you know, look at how those systems can benefit the client. So we're putting together a package. I think the thing with the technology, it has to work in terms of with a care provider, you have to be able to package things up. I think that's the key. To make it sort of an understandable system for people, and to make it work in the way it should work. So we're introducing an exceptional care solution, which is something that we have put together. So it's a mesh between technology and the care service, and it's going to be a very sort of flexible system that will enhance how we can, you know, provide care and support to our clients. And another area where we've looked at sort of using more technology is around sort of the marketing that we do. So in terms of building an enhanced content solution for our offices. So we have a digital marketing team that are looking at sort of how do we build content locally using the different channels that are available to us. So those are the sort of two key areas that we've been focusing on at the moment in terms of, sort of building our services.
Okay, that's exciting. And you're a member of the campaign to make VAT zero rated for social care. How important is that for Radfield, and also how do you intend to reinvest that money back into the company?
Yeah, sure. So I think, you know, as a sector, we founded the campaign to basically bring more investment into what is a very underfunded sector, and I think also to bring some kind of a level playing field across care. So the whole of the sector in providing care, we don't charge VAT on our services, but we have to pay VAT on all of our rent, our utilities, our bills, all of our running costs. And that's something that's uniform across, you know, all home care providers and in residential care as well. And that's something that, you know, if you compare that to other industries that work in the care sector, it's not the same. So some of the products that are sold are zero rated as opposed to VAT exempt. And that creates some challenges for us. And I think when you're looking at a sector that's been underfunded for many, many years, and when you see providers who are, you know, consistently unable to provide a quality care service based on the fees that local authorities sometimes commission care for, if you changed the VAT regime for care, you would instantly drive investment back into the sector. It would be immediate, it would be uniform, you know, across the board. And so you wouldn't have to go through a very complex political process of trying to reform the whole care sector. You could make a very simple change to the VAT regime that would drive investment straight into care providers' bottom lines effectively. And that would help with resilience, it would help with sustainability for some of the care providers that are struggling to keep going at the moment. And I think, you know, maybe the other end of the market where it would help is to drive innovation. And that's something that, you know, I've been very keen on is how do we use greater investment in care to improve care services. And I think one of the key areas, as we've touched on, is technology. That's a very obvious way that we could build a stronger care service, a better care service. And, you know, and some of the technology systems, not necessarily the direct client-facing systems that you put into someone's home, but, you know, some of the logistics platforms, some of the HR platforms, some of the recruitment platforms. These are key things to actually help recruit and retain and build the training and skills of a care workforce. And that's what we need going into the future. We need a larger care workforce with greater skills, and that's something that's a real challenge for the whole sector. So greater investment into the care sector will help us do that. It will help us build the care workforce for the future, and drive through greater skills, which ultimately benefits the clients. So you'll have a more resilient sector that can deal with more people needing care, and do it in a better way. So it's an absolute win-win, I think, from my perspective. And I think when we've done the sort of analysis of the figures as well, we're not talking about a massive investment from the Treasury, to make that change. And when you consider then the knock-on effects, so an increased use of technology can drive massive cost savings through to the NHS. And I think that's something as well, it's to understand home care as a sector in its place within the overall healthcare system. So the NHS with residential care, and how the role that we can play as a sector has a massive impact on the burden on the NHS. You reduce the number of people being admitted into hospital with health conditions, maybe through using technology, maybe through better training, whatever that may be, then you're reducing the NHS bill, you're saving the government money. And I think when you start to look at things in that context, the cost of the investment would be minimal compared to the savings you get at the other end.
How hopeful are you in convincing the Treasury to change that system?
I think it's a campaign that's been going, our campaign, not for that long, but generally in the care sector, there's been discussions around this change for many, many years. I think, now is the time, if we're ever going to see any change, having gone through the pandemic, having seen people's perception of care changing, with Brexit coming through, imminently, these are all opportunities. There's never been a better time to push for the change. I think there's strong reasons for the change, and I think we're able to communicate that as a campaign now better than ever before, because we can actually understand the impact we've had through the pandemic and the impact we can have going ahead. You never know whether we are going to be able to push the change through. It's not something that's a given, let's say, but we're doing our best, and we'll keep going with it, and we'll keep raising the issues and talking about it in the forum, because I think it's very important for people to understand how do we move care forward as a sector, and this is part of that discussion. It's kind of where does care sit, what are the financial implications of the choices we make today, and how that will affect tomorrow.
Okay. Speaking about reform, Boris Johnson, I don't know if you heard him, promise today again to fix the social care system, but he referred to the social care as care homes. So do you think there's still that education needed within politics around what social care means?
Yeah, absolutely. I think you see it continually in that home care as a sector is the forgotten cousin of healthcare, generally speaking, and there's a big focus on residential care, but when you look at the numbers of people who are supported by home care services compared to the numbers of people supported in residential care, and the impact that we have, it's very, very significant, and we are often overlooked as to the effect we have and the funding we need as a sector. And even with regards to some of the policy changes, through COVID, it's been very much focused on residential care. And even recently there was the announcement of a new infection control fund to be driven through initially residential care, and it was only through kind of us as a sector going, hang on a sec, we're working here too. So I think it's important for those, for that change to happen, and for people to have more recognition of the role of home care, domiciliary care, in the social care system generally. Okay.
And what's next for Radfield? What projects have you got lined up for the next 12 months?
Well, we're really busy. We are looking. We're looking at supporting some of our new franchise partners coming through, getting their businesses set up. So that's a big focus at the moment. Is how do we actually get them through to launching their businesses, and obviously the people we're still in early discussions with who want to come into the sector. So we're looking at growing the network and supporting the network to grow sustainably. We're always very much focused on the right people in our sector. So we have to find the right people so that they build the right kind of business, so that they look after our clients in the right way. So that's a real, something that's ongoing work for us. We talk to a lot of people. We are constantly improving how we recruit our franchise partners to come into our network. We're looking at developing new services. So I touched on the technology packages we're putting together of how we support people with technology. And that's something that's key to respond to kind of how people's needs change. I think that's something we think about quite a lot as an organisation, is, you know, the changing demographics of people that we're looking after who need care services. It's changed massively in the years that we've been operating, and it will change going ahead. So we need to create services that respond to the changing needs of the people who use our services. We're looking into, you know, whether a living care service is something that will benefit the network, and something that we are planning to roll out across the business, because I think there's a strong need. And I think when you asked Hannah about you know, people coming into home care to leave residential care, I think that's something where, you know, there'll probably be more people going into living care, having living care services at home, as opposed to the residential care.
Yeah,
and again, it's
demand for that.
Yeah, very much so. And I think again, it's responding to choice. It's responding to what people want from care. You know, if you think back 20, 30 years, people chose to go into retirement homes, and no one does that anymore. So there's a big shift, and I think living care is a very, you know, important part of that growing need for care in different ways. And we love technology. We've always been very keen on sort of adopting technology soon. We've been early adopters of many of the new logistics systems coming through to help us provide care more safely, better, and we're constantly looking ahead to what's coming down the line. So, you know, I think we are very excited about our technology platforms that we're going to be launching soon.